Hey everyone, have completed week 4 and this is what happened. Started the day in an interesting way today because I had an email from the Australian government about my Centrelink. So for those who don't know, I'm on a disability pension because I'm unable to work due to all my medical conditions. Under the way the payments work, you're allowed to travel overseas for 4 weeks before your payments get cut off, which I have no issue with. However, there is a clause that says if you're traveling overseas for medical treatment, you're allowed to travel for 8 weeks before your payments get cut off. Obviously, I'm here in Cyprus for medical treatment. However, Lyme disease on the list of diseases that they have at Centrelink on their computer, next to it, it says that adequate treatment for Lyme disease is available in Australia, so patients do not need to travel overseas for treatment. So instead of getting the 8 weeks for medical treatment, I've been cut at 4 weeks because the treatment I'm having is not approved treatment. I'm not surprised. I knew it was coming. I had a discussion with them before I left Australia. However, after being here and seeing what's available to me here that I can't get in Australia, it just makes me a bit angry that that is the take when I know I can't get access to the things I'm getting access to here back at home. I am not on Centrelink for my Lyme disease because, again, it's not on their list of approved diseases. I am on disability for my POTS, the damage to my legs, the fact I regularly pass out, the bladder stuff, and all the other complications I have. So I'm allowed to have disability payments for the illnesses caused by the illness that they won't recognise under Centrelink. So it's very confusing, but that is the situation, and that's the situation thousands of people in Australia find themselves in when it comes to this. So very, very complex. I feel kind of like I'm in some warped reality TV show or movie at the moment, because I couldn't have even written stuff like this. It's just so out there. So that was how I woke up this morning, then headed to the clinic. This morning I started off with UFO, then I had water balance, which is still my favorite treatment because I just get to chill for 40 minutes while laying on the water balance mat and enjoying my book. Then I had infrared sauna and went down for TEMPAS. However, we have decided to change my TEMPAS now. Instead of doing 3 sessions of TEMPAS each week, we're going to do 2 sessions a week, but do 15 pass on each of those days. It makes me a lot more tired, and the side effects are a bit more full on, but it means my veins are more likely to survive till the end. So it's worth it, because they'll only be getting 2 of the big needles each week instead of the 3 they were getting before. I'll still be having needles every day because of the daily IVs, but the IV needles aren't quite as big. So I had the 15 pass today, then my 3 IVs, and then another session of IV laser. And I'm still amazed at how they zap the bacteria in my blood by putting the laser through my cannula. It's just so clever. Tomorrow I have my follow-up appointment with the doctor to check progress because we're about halfway into treatment now, which is exciting. And as I said last week, starting to get a few results, which is great. Today I started off the day with UFO, then I had my rehab session, which is very intense work, mainly on my legs, but also covering all the other muscles in my body. We're trying to rebuild some of the strength that I've lost. I also have my 3 IVs and the ozone bags on my legs. Then I had my follow-up appointment with the doctor. So this is my halfway progress appointment, and was very amazed again, but this time for good reasons. The results are all heading in the right direction. These are the scans of the inflammation in my body. And you can see the difference from when I first got here to now halfway through. The first scans are just full of red and all the bad stuff. These ones, the colors have died down a bit. There's a lot more green, a lot more light blue, and all of that is really positive. Doctor was very happy. I'm trialing a new pain medication for him. It's a new one that's just been released, and he wants me to test it out. And that hopefully is going to alleviate some of the pain I'm in. Today I started off the day with Icun, and much better to do lymphatic drainage on the smaller settings that we worked out last time I had it, much less painful. Then I had UFO, water balance, and infrared sauna. Then followed that up with my 3 IVs, ozone bags on my legs, and autohemotherapy. I also had a meeting with my patient liaison to go over my program for the rest of the time I'm here. When you have a long program like mine, they only do the first month when you first arrive, so they can see what treatments you respond to best, if there's any changes that need to be made, and then they put together the last couple of weeks. For me, the only big change is they're throwing in a lot of extra rehab to try and help strengthen my muscles to prevent falls. So that's really the only major change. For those who have asked how I know what I have on which day, I have a program and it looks like this. The columns you can see basically are the ones that I have appointments for. So the staff intensive treatments, they're the ones I have set times and days that I need to be at those treatments. Then at the bottom, I have sessions that I can do whenever I like. So I just tie them in with my day and how I'm feeling on the day, and then I can decide where in my schedule it works best for me, depending how I'm feeling. So this was the first program I had, and then this is my second program. So you can see my days are very busy. There's very rarely a spare moment in there. So Thursday half day again today. Started off with 10 pass, which was 15 pass, because we've increased the amount of passes we're doing now. No problems getting the needle in today. It went in fine, even though it's the big needle. But once it was in, it was a bit sluggish for a while, especially the first 4 passes. But amazing after the toxins had been taken out the first 4 rounds, how much better the circulation and blood flow and everything was once the ozone had been infused. I think it just goes to show how well it works and how much it improves the circulation. Could really see that today. Then I had my 3 IVs. I had IV laser again, then UFO, and finished off with my favorite treatment, which is massage. Very relaxing. They just massage joint cream into all the different muscles. I am extremely exhausted today. I think the toll of the past few weeks is really catching up with me. I'm also in a lot of pain, as well as all my regular pain that I have. The bruising is still quite significant, but well and truly ready for a break. The clinic at the last minute has decided to close Easter Monday, so they're only opening for Good Friday. So I'm going to go in and have my treatments tomorrow morning. Then I'm off till Monday, so I've decided to take a mental health break I had a bunch of frequent flyer points from back when I was traveling a lot for work, so I'm going to use them. I have booked a hotel on the beach in Ayia Napa, which is about an hour from where I'm staying in Nicosia. And I'm just going to go and have a few days away from treatment, away from needles, and see some of Cyprus other than the clinic and the chemist, which is all I've seen so far, and just enjoy that bit of relaxation. Well, today I just whizzed through treatment as quickly as I can because I'm ready for Easter break. I started off the day with my 3 IVs and the ozone bags on my legs. Then I had infrared sauna, UFO, and finished up with physiotherapy. Now I'm done till Tuesday and looking forward to heading to Ayia Napa this afternoon. And I'll do a separate video on that for those who also want to see some of Cyprus other than the clinic.